Okay, how's it now? Still beeping? Still beeping, you guys? Still beeping. Yeah. Still beeping. Beeping? Someone tell me. Yes. No. Can't hear me. Can you hear me? Can you hear me? Okay. It's working. Not beeping? I'm saying something. Something, and then something. Beeping is gone. Yabba dabba doo. All right, cool. Low end, yes. Oh, wait, yes. You can hear me. Is that you saying you can hear me, or you saying yes? There's beeping. Yay, Colette. Thank you. Yeah, you can hear me and no beeping, right? Of course, Instagram never beeps. All right, cool. All right, well, whatever happened, happened. And we'll never know what it was. It was just a blessing from above. Anyway, so let's. Great. Yay. Okay, cool. So listen, let's look at us here. You know, here on this side of the world, we were just forgiven. Yep. And you folks on the other side of the world, like in the U.S. and Canada and Europe, you're about to be forgiven. So that's good news, right? So we were just forgiven, and you're about to be forgiven. And so what the hell am I talking about? Well, I'm talking about this phenomenon known as sleep. When you go to sleep, do you realize you can crawl into bed like exhausted, wiped out, bummed out, or just exhausted and happy, and you're going to wake up in the morning feeling great? Why? What happened? Well, God, I'm sorry for those who don't know about God, let's call it nature, has this really cool relationship or kind of deal with us. Like no matter what we do during the day, no matter what we eat, activities we engage in, we go to sleep and we're forgiven. We're repaired. Everything is repaired, and it's a new us. And that's a beautiful thing. So, I know we take care of our cars, and really take care of our cars, and we've got to make sure our phones are charged, and we do all that stuff with these devices and machines, and then we don't even think about us. So anyway, you are forgiven every night when you go to sleep for all the physical transgressions you engaged in. And if you're a human being, you're gonna do that sort of thing. Yeah. So anyway, yeah, and I'm not just talking about our whatever whatever kind of person you are, whether you do nice things or not nice things. I'm not talking about that. I'm just talking about the physical reality is that we are forgiven every day. And BMWs aren't. Even Rolls Royces, Maseratis, they're not forgiven. We are. Okay, so let's change our oil once in a while. Let's make sure we got our tires rotated. Okay, well, let's do that. All right. So anyway, welcome. I'm glad. So okay, it's hard to believe. No beeping, and everybody is ready to go, I think. Are we ready to go? Yeah. Yeah, I guess we are. Okay, so now okay, all right, go. We're good to go. Okay, so let me get over to this stuff here first before I get started. So I already started, but you know. Anyway, announcements. Yeah. So this is Sunday Night Live, Monday morning live, Sunday morning / now. It's now live. We're live now. And as you know, you submit your questions prior, and then I'm trying to answer them. And you submit it. You can go to the website, drlodi.com, drlodi.com /live, and then you can find out where to submit your questions. Okay, great. And if you've got an active CFC situation going on right now, just give our clinic a call, Oasis in Arizona, and or contact them by internet, and let's get things started. Okay. So unless, of course, there's this and that and this and that and this and that, then this and that and this and that, you can't. So I understand, because the life is full of this and that's all over the place. Everywhere I look, there's a this or that, you know. So I understand, I get it. Yeah. Anyway, so but would be really good if with regarding these questions, if you could join me on you know, in the inner circle, right? So we have 3 groups: health and healing, parasite, and the CFC group. Okay, and for those of you who have just joined, this is your very first time. We don't use ugly words like, well, it's not an ugly word. It's really a nice word. The word cancer means people that were born between June 22nd, June 21st, and July 22nd. And they're nice people. I like these people. I like all 12 groups of people. But it's just that word somehow got associated with chronically fermenting cells inside our body. Somehow, I think it was an algebraic equation, and the variable that caused it to happen, the enzyme that caused it to happen is this little ball of disgust, actually a big ball of disgust and rank foul. It's called Rockefeller. What can I say? There's a Rockefellerian enzymatic reaction to humanity, and it did all this stuff. Anyway, I'll go into that in exhaustive detail in my book that's coming up as soon as I get a chance to finish it. Anyway, so those 3 groups, and the good thing about those groups is if you're in those groups, we can interact. You can ask a question, I can ask back, because most of the time I get a question and I don't really have all the information, so I can't really understand perhaps the full intent of the question or all that, although I usually know what people are asking for, because I think no matter what the question is, you're just saying, help. That's basically what I hear. Okay, so it's good. Anyway, but these are good. So remember, this thing here, this live stream is on X, used to be Twitter, X, and TikTok, the new TikTok, at Dr. Thomas Lodi, MD, right? Mythology doctor, Dr. Thomas Lodi, MD. The rest, Instagram, Facebook, YouTube, Rumble, blah, 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 are Dr. Thomas Lodi, no MD, Dr. Thomas Lodi. Okay. You can also stream live on the internet, on our website, Dr. Thomas Lodi, drthomaslodi.com. All right, so now there's a you all know about the Beljanski conference, right? I was supposed to lead off the conference by being the first speaker, but I couldn't get there. Couldn't get to the U.S. Thank God. I mean, yeah, couldn't get there. Anyway, so instead, I'm going to be doing this live virtual one, and it'll be this coming Tuesday for you guys at Eastern Standard, which I guess New York, Florida, Maine, blah blah blah, Massachusetts, is going to be 8 p.m. your time, which means what, 5 p.m. in West Coast, right? And of course, for me, it's 9 a.m. Wednesday. But anyway, so just let you know that it'll be a live thing, and I don't know how you join it. You can find the Zoom link in on our recent posts on every social media platform. All right, so it was posted, I guess, today, Sunday, May 4th, for you guys. We're confused over here. We think it's May 5th. Instagram just told me something about my hand gestures. What am I supposed to do with my hand gestures? I'm Italian. I can't talk if I can't use my hands. You know what I mean? If you handcuff an Italian, they can't speak. Anyway, so. And then the other one, Dr. Jen Simmons and we've done a couple podcasts recently, and it's airing now, I guess. Okay. So as of May 2nd. So you guys can watch that. It's good. I love talking to her. She's such a brilliant woman. Amazing lady. Yeah. All right. So now I'm going to get into some questions. All right. Sound like a good idea? Yes, it does. Cool. Okay, here we are. Now, first question is by Andrea, from Andrea. And the question is ketogenic diet. You guys remind me to do that later because I got to try to remind me again. Okay. Good morning, Alice from Sydney. Where was Crocodile Dundee from? He wasn't from Sydney, was he? Wasn't he from the Outback or something? Okay, anyway, all right, we'll get it. Okay, listen, how do you deal with procrastination? Well, let's think about that. See, I'm procrastinating. No. You guys have some amazing questions. If you joined, where are you calling from? I'm calling from Thailand. Anyway, if you guys join these groups, we can talk. I can't do that right now. I have to do this. Okay. So this is from Andrea. She's saying, I have diffuse sclerosis of my spine. Does the Letrozole I'm currently taking on have any effect on it? I've been on it 3 years. Wow. Well, yes, it does. Let me do this. Let me put this one here and put this one here. It goes there. Yeah. And then these two are here. Okay, cool. This one I'm going to do like that. I got one of these things on my computer where I can try to be organized. It helps me go organized. All right. Okay. So here we are. So does Letrozole have any effect on the fact of diffuse sclerosis of your spine? Well, the word sclerosis means scarring. And I'm not sure what you mean by that, because is this new? Has this diffuse sclerosis just come about over the last 3 years while you've been taking this? Because what happens if you have if you have bone metastasis and they heal, many times the consequence is that there's scar material left over, right? Because you heal it, and it's, just like any kind of wound. But so the letrozole could actually, you could, if it was actually effective in helping to eliminate some of those metastases, that could do it. But I don't know if you have this condition prior or not. But the question is about letrozole. Now, letrozole, as you all probably know, is what is known as a aromatase inhibitor, right? And the way that works, why would someone be on an aromatase inhibitor? What in the world is aromatase? Aromatase is an enzyme that takes testosterone and will turn it into estradiol, and androstenedione into estrone. Okay, and it blocks. If you take an aromatase inhibitor, now see, especially in postmenopausal women, and the reason why it's prescribed for postmenopausal women is because postmenopausal women are not producing any estrogens in their ovaries anymore, and their adrenal glands are producing androgens like androstenedione and testosterone. So when those circulate and they wind up in some tissues that have fat cells happen to have a lot of the aromatase enzyme. And so breasts are, made of little sacs, lobules, that produce milk. And then they're made of ducts that carry the milk to the nipple. And then they have connective tissue and they have fat. And that's what a breast is. And so the fat in there will, when it's exposed to those androgens produced by the adrenal gland, turns them into estrogens. And so when we look at a postmenopausal woman's estrogen levels in her breast, they're higher than in her blood. So you do a blood test, that's not going to tell you what's going on in the breast. The breast will definitely have more, all right, estrogens. Unless you take an aromatase inhibitor and you block that enzyme, and then you don't get that conversion as much. All right. So so when we're talking about with anastrozole, letrozole, and a couple others. So letrozole is purported to be the one that is the most specific, just blocking that particular enzyme, not any other ones. Whereas the other aromatase inhibitors could be having other effects. Okay, so it's considered the most specific. All right, now. So in that regard, you would say, well, that's great. Okay, so that's great because I have estrogen receptor positive CFCs. So therefore, if I can block the estrogen, it won't stimulate the growth of the CFCs. Well, that's true, and it's sort of true. So let me put it to you this way: it's breast tissue, which is actually part of the reproductive system. Okay, because reproduction doesn't only involve the getting pregnant and delivering, but it also involves caring for the baby, and breasts are for that. So it's all part of the reproductive system. And guess what is really involved in all of this? This 70% fat thing in our head called the brain is incredible. There's no computer anywhere near it. And if AIs could salivate, they would salivate when they think about brains because they're incredible. Anyway, so And since the brain is involved with the breast and the reproductive thing, right? Clearly, then the brain must have estrogen receptors too, and it does have estrogen receptors. So now, in fact, one thing to know about both anastrozole and letrozole is that they can result in something I mean, you might not even think about it, but one of the side effects is visual hallucinations, repeated visual hallucinations, right? So, I mean, wait a minute, where are we going here? I just want to show you something. I found this a great article, but anyway, so in addition to the letrozole and anastrozole, but letrozole we're talking about, causing joint pains, muscle pains, numbness, increasing the loss of bone, so you get bone density decreases, right? You get you'll start to get what they call vasomotor responses. In other words, when the estrogen goes down, you know vasomotor means that your arterioles open and close and open and close and all that, and you wind up getting hot and sweaty and flashes, right? They call them hot flashes. You also got genitourinary problems, right? Including decreased libido, vaginal dryness, and actually something called dyspareunia. Dyspareunia is painful intercourse. So when a woman's having intercourse, it's painful. So that's usually a deterrent from having sexual intercourse. You know, you can also get urinary tract infections because there's genital urinary, all that area there. Well, as it turns out, there is it's called the SRC1. It is produced in the brain. Okay, it's a chemical that does a lot of different things. All right, and it actually downregulates that. And you say, well, so what? Why? What is it downregulates that? Well, what does that mean? That means we're talking about the hippocampus. Now, the hippocampus is that part of the brain that processes emotion and fear and things like that. Big time with fear, and different kinds of stuff. It also the hypothalamus, the hippocampus, the all anyway, midbrain and brainstem, all around there. It blocks this chemical SRC1, right? Now, which will have an effect on both estrogen and androgen, male hormones. Okay, and why is that a problem? Because that's where we process. That's where we do a lot of our thinking and our cogitation. Okay, so what happens if you downregulate that? It's going to affect your ability to learn. Your memory is going to be decreased. Your moods are not going to be good. Your cognitive functioning will not be fluid, and also the mediation between your brain and your other hormonal systems. It's called neuroendocrine. That whole regulation gets disturbed. So it has a great effect on the mind, on the brain. So not only are we seeing pain problems with joints, muscles, genital urinary, but we're also seeing and visual hallucinations. We're also seeing problems with memory, thinking, mood. So it's pretty heavy duty stuff. So the thing is, if you don't have to use them, don't. And here's the good news: you don't have to use them. Yeah. So, but I mean, there's studies. There's a study in 2022. Aromatase here, let me tell you the way they write. Aromatase inhibitors are the gold approach. The gold approach. I mean, do they mean gold standard? Anyway, they messed up on that. to hormonal therapy for postmenopausal women with hormone-responsive breast CFCs. They don't use CFCs, but I do. The third generation aromatase and estradiol have been shown to be more effective than the SERM. You all know what the SERM, right? Selective estrogen receptor modulators such as tamoxifen, right? Okay. Oh, by the way, there's a great word. There's a great word. You've got to learn this word, okay? Because this is what this is. I just want to show you how not only does the medical profession make up what they call diseases. We get new diseases every year. There's new ones. I mean, the DSM thing keeps growing. The diagnostic and statistical manual, blah, blah, blah. It keeps growing. We got more and more diseases. Okay. Well, there's a new word. It's called pharmacovigilance. And the professional societies like the American Medical Association and ASCO and all, are urging doctors to develop a pharmacovigilance. That means try to be aware of the side effects. They call them side effects, but you know what? They're not on the side. They're right in the middle. Right in the middle. They should go middle effects. The truth is, they're effects. So, of all the 35 effects that you get from taking this poison, one of them is going to be what you're looking for, like, blocking aromatase. The other 34 you don't want. And so to make in keeping with the linguistic manipulation that everyone is so good at doing, since who started all this linguistic manipulation? I mean, it's been around since humans have been able to talk, but the guy who made it really brought it to an art form was a guy named Bernay and Ivy Lee. Ivy Lee and Bernay. But Ivy Lee, by the way, was Rockefeller's PR man, right? And since Rockefeller was a pretty bad dude and everybody knew it, Ivy Lee came in and he developed this whole thing. He developed the photo op. I mean, I'll go into that in the book. I do go into that in the book. But Ivy Lee is pretty cool. And Bernay was so smart that he took the word propaganda, which they were using in World War I, and had a bad connotation. So he changed the word propaganda to public relations. Isn't that great? So, yeah. So when you're getting public relations officer at your company is really the propagation. What's the word? What's that word again? See, I think it's the Letrozole. I got to get off that Letrozole. Propagandist, your propaganda department. All right. Anyway, pharmacovigilance. Pharmacovigilance is a way of doctors to be aware of all the side effects. It's nonsense. They don't care. Anyway, so here's what we're doing. So I mentioned this last week, and I'll mention it again for every week that we've ever meet, and that is this: when they say you're ER positive, what that means to diagnose that, you get a piece of the tissue and you send it off to the laboratory where you've got the pathologist who's a brilliant person, male or female, and those are the only two choices. There's no other. It's either male or female. I don't know. There might be some other monsters in the back, but so they look under the microscope and they do, and they tell you exactly what they see. All right. So so they get a piece of it, they do that, and they send it off, and they're able to give you a diagnosis. If when they do this certain kind of staining, if it's a dye that stains the nucleus, and in the nucleus where you have a lot of activity with the nucleoli and stuff like that, when there's a lot of activity, in other words, it's dividing, it's busy dividing, the cells dividing. So a dividing cell will have more nucleoli, more dark areas, right, on the stain. So in order to get the diagnosis of ER positive, you have to have one Let me say that again. 1%, no zeros. 1% of the cells have that staining. You're called ER positive. 99% are not staining like that, but 1% is, you're diagnosed as that. Yeah, I know it's hard to believe, but it's actually the truth. And then the ultimate diagnostic, what is it? Whatever the word is, whatever the medical term is. The ultimate way to diagnose is if it is responsive to tamoxifen or letrozole. Anyway, it's madness. It's madness. It's madness. It's madness. And by the way, you can be estrogen positive here in this in your breast, and when it drains into the lymph node, and the lymph node can be negative. Anyway, so it's all that's what. So anyway. However, it is true that we see the condition if it's an active breast CFC or prostate, we see that go down to some degree with these drugs. So there is something going on there. We're not going to completely negate that. Okay. So here's the idea. Now we know also that there are two kinds of estrogen receptors that we know of, alpha and beta. We call them alpha and beta. Just anyway, alpha. Why? Because when it's stimulated, it does certain things like causing breast tissue to grow, tumors to grow, and breasts and uterus. And, that's its job. And then the estrogen receptor beta does the opposite. It shrinks them down. And our bodies, whether you're male or female, remember, males make more of one kind of one group of hormones and less of the other that females do, and females make more of this kind and less of the other. But we're all the same. Yeah, we're all the same. We're all the same. I know you don't want to hear that, but we're all the same. So if you ever don't like this person, it's probably because they remind you of you. No, not always. I mean, William Henry Gates III does not remind me of me. Anyway, and neither does Klaus the Slav. But anyway, so ER beta shrinks. So we have three kinds of estrogens. We have estrone, estradiol, and estriol. So the estrone and estradiol are strong agonists for the alpha, whereas estriol is strong agonists for the beta. And they are secreted and produced at different times during our lives and our cycles, because that's the way biology is. Biology is cyclic. There's nothing ever consistent. It's always cyclic. Things are cyclic. Just like you have day and night, there's just everything's cyclic. Okay, nature is cyclic. Okay, so don't ever do anything all of that. So, which in that same philosophy goes into hormone replacement, biologically identical hormone replacement. You always do it in cycles. And you're thinking, you know what? I've got colon problems here. Why am I listening to all this? Because there happens to be estrogen receptors all over the colon, all over the pancreas, all over the lungs, and they're all. And sometimes if you have, depending on the pathologist, you did a colon resection. You took out the tumor of the colon, and the report back is that it's HER2 positive. HER2 positive? What are you talking about? Yeah, HER2 positive. And so they put them on those, Herceptin. Yeah. So okay. So don't, and like we were saying, there are estrogen receptors in the brain. There are androgen receptors in the brain. So when we're talking about estrogens, androgens, we're talking about there's no cell, there's no area in the body that's not going to have some sort of response to it. Okay. All right. So that's very important. So, but here's the thing. So knowing that there are two receptors, alpha and beta, wouldn't it be great if you could stimulate the beta, since it shrinks tumors? Turns out you can't, but certain botanicals can. Botanicals, you all know what that means, right? Something that you get from it's not boats, it's plants. Yeah. Okay. Anyway, so I'm going to read to you this here. This is a great article, and I think you should all get the article. It's called Estrogen Receptor Beta Selective, beta with a B. Estrogen receptor beta selective transcriptional activity and recruitment of co-regulators by phytoestrogens. Yeah, okay. It's in the Journal of Biological Chemistry, 2001. Estrogen receptor. Just remember, just put in your search engine Medscape, either Medscape or PubMed or something. Not Google Scholar. No. Remember, when you say the word Google, you're really saying CIA. Okay, so estrogen. So estrogen, just put estrogen receptor beta, and then phytoestrogens. Estrogen receptor beta, phytoestrogens, and put Journal of Biological Chemistry, 2001. Anyway, very. I'm going to read to you a little bit of this. Okay, so here's a reading from the article. Estrogens used in hormone replacement therapy regimens may increase the risk of developing breast CFCs. Say what? Yeah. Mm-hmm. By the way, they're talking about pharmaceutical based, right? Okay, they're not talking about the natural stuff. Paradoxically, high consumption of plant-derived phytoestrogens, particularly soybean isoflavones, is associated with a low incidence of breast CFCs. Did I hear that right? Yes, I heard that right, and you heard it right too. So whatever you thought about soy, throw it away and listen. To explore the molecular basis for these potential different clinical outcomes, we investigated whether soybean isoflavones elicit distinct transcriptional actions from estrogens. Aren't they smart? God, they're so smart. Our results demonstrate that the estrogen 17 beta estradiol, which is estradiol, effectively triggers transcriptional activity on both ER alpha and beta. In contrast, soy isoflavones, genistein, diazine, and biocanin A, are estrogen receptor beta selective agonists of transcriptional repression and activation at physiological levels, meaning from eating. So we have shown that isoflavones elicit distinct. You already said that. These data are consistent with the observations of that helix 12. Our results suggest that isoflavones act as a natural SERM, selective estrogen receptor modulator, like tamoxifen, right? Act as a natural SERM, which may be safer than estrogens. Wait, you didn't mean maybe. You just said it can cause it, and this doesn't. So why are you using the word may? You see how they use the word may? They're using the word may because it's not a drug, and they didn't patent it. I mean, they patented it, then it definitely does. And it is may. So they just said, they just told you that HRT is associated with an increased risk, and that this is associated with a decreased risk. And so now this stimulates the betas, but it may be. All right. I just want you to realize their language. They use that to keep you not so into the plant. They want you to get into plants. So it may be safer than current HRT regimens because they selectively trigger the transcription pathways of ER beta. Estrogens in HRT also trigger ER alpha, which promote the proliferation of breast and endometrial cells. Don't want that. Say, all right, so what I'm saying to you is this. Okay, then I got to get some soy. You got to get some soy. And who has to get some soy? Everybody. Because we all have stomachs, right? Unless you had a visit by Mr. Whipple or something. But, stomachs, bowels, bladders, female genitalia or male genitalia, we all have bones, we all have brains. So that's why this is really important. So keep that in mind. Don't think that estrogens are for girls. Okay, don't think that. All right. And don't forget to be pharmacovigilante. What a thing. Yes, he's a very pharmacovigilant doctor. We like him. Okay, now, this is from Renuka. So, Andrea, I hope that the soy is just one of them. The other one's flaxseed, green tea. There's other things that are botanicals that will stimulate beta. So will estriol. So, okay. This is from Renuka. I've had papillary carcinoma for the last 2.5 years. Usually people, when someone uses the word papillary, they're usually referring to thyroid. Because thyroid has 4 different kinds of, not different kinds, there's different locations from which the CFCs can arise. I've tried many alternative therapies like extended water fasting, high-dose curcumin, the Ann Wigmore wheatgrass protocol, raw food, IV vitamin C, regular iodine, etc. The tumors aren't shrinking, but not growing either. I do struggle with being overweight, though. I lose it and it all comes back. What can I do for the tumors? I feel frustrated and helpless. I get it. I get it. Of course you do. And so let me say this, first of all, Renuka, and to everybody listening. When anybody says, I've done this, I always say, how did you do it? Extended water fasting, I'm not sure what that means. Do you mean like prolonged water fast would be 2 weeks or more? Is that what you mean? And you've done that multiple times? Or do you mean you've done like 2 or 3 days multiple times? Or what? And what's very important about fasting is what you're doing when you're not fasting. What are you eating when you're not fasting? All right. So, anyway, and so the fact that you're struggling with, and you said raw food as well, wheatgrass protocol, raw food. Okay. Now, if you wheatgrass, raw food, and fasting, I don't see in those 3. If you're doing those 3 things, weight will not be a problem. It's impossible. So what that tells me and tells you is that you're not quite doing the raw food enough. And the fasting, it's got to be regular. And then wheatgrass is just a really, it's like getting a powerful, it's nutrients, a bunch of nutrients, really good, important nutrients. I can't stand the taste. I used to like it, but now, fortunately, if you don't like the taste of a plant like that, you can do a rectal implant, enema, retention enema. Yeah. Anyway, so now, also, high-dose curcumin. I don't know what you mean by that, because curcumin, if you take it orally, doesn't matter how much you take, you're only going to absorb 3%. You can't absorb a lot. If you add peppery, some sort of pepper with it, you can increase maybe up to 5% or maybe 6% max, which means most of what you're getting is not even being absorbed. And then the other thing about curcumin, once it gets into the blood, it's very quickly metabolized by the liver. And so it's really hard, even IV, to get adequate curcumin because I'll tell you, it's probably one of the most, it's right up there with vitamin C, powerful anti-CFC and inflammation, and it's just magic. The problem is getting it to the target. So what they've done is they've made the liposomal for injection, IV, so that when it gets into the blood, it doesn't get metabolized so quickly and it gets over to the tumor. Okay. So I don't know. Right. So there's many other things you've got to have. You should have been doing by now, Renuka. You should have gone to a biological dentist and made sure you don't have anything going on. Extractions, root canals, anything. Metal in your mouth, anything like that. All right. You should have done a good thorough juice cleanse, just juice, 3-4 liters a day of fresh vegetable juice with enough fruit to make it delicious. And for 3 weeks, 6 weeks, however long you can, you're going to feel fantastic. You're not going to feel bad. You're going to be highly nourished, except for fat and fiber. So yeah, and then you do periodic water fasting. That's okay. You're doing all this. You're doing colonics, or in India you can do panchakarma, enemas. As you keeping things going, you're going to be moving around all throughout the day. And what I suggest you do is join our group and listen to our Tuesdays. We have either Vanessa or Darren on. You all know that. You all remember that, Vanessa or Darren. Darren will tell you how to move. You got to keep moving. Remember, when we stop moving, we're dead. When we stop moving, we're dead. Once again, when we stop moving, we're dead. So keep moving. Keep moving. Did you ever see a time lapse video of someone sleeping? I don't know how someone can wake up in the morning and say, I feel rested, because if you look at them sleeping, they're, we move around a lot, so we're always moving, okay? You've seen your dog, right? You go, weird things, yeah. Anyway. But move. So that's the other thing you got to be doing. Yeah. Now, the other thing I want to talk about, I'll talk about it in a minute. I'll wait. It's a subject that nobody wants to talk about. Not me. You wonder what that subject is? Okay, we'll get into that in a minute. All right. So anyway, now Renuka has the next question too, and that is about the topic is iodine. If I live in a place, India, where they don't understand iodine testing, don't do the iodine loading urine test, how can I check my iodine levels? I sometimes worry I am overdosing, and I hear this could also be a source of papillary carcinoma. Well, Renuka, don't believe everything you hear, especially that. Now, interestingly enough, regarding iodine, because we're always talking about iodine, right? I talk about it all the time. I don't know why. I think, I've been talking about it enough by now. People should be following suit. I mean, I don't know who talks about it. So, anyway, it's very interesting that one of the first realizations about iodine in breast by the West, of course, the West, was there was a publication in 1924 where they found that the places in the U.S., which is called the goiter belt, which is in the middle part of the country, because it's far away from the ocean, and the ocean has iodine and it comes in the rainwater. All right, so far away. So they have a lot of propaganda thing. They have a lot of goiters, and they found out in 1924, and it was published, that those people with goiters, if they got CFCs, had a higher mortality rate. All right. So then they realized that there was an association of low iodine, but it wasn't just breast, thyroid. I mean, it was also breast. It was ovarian. It was endometrial. It was ovarian, endometrial, uterus, colorectal, thyroid, and prostate, also associated with low iodine. Yes. Okay. Now, Lugol's iodine solution has been used for about 200 years now. So it's kind of must be safe, right? Yeah. So one drop of the 5% will give you 6.5 milligrams of molecular iodine, the I2, not the iodide. Okay. And that the iodide is what the thyroid uses to make thyroid hormone. But the iodine is not. The iodine does so many things, but it's not having enough of it. The first phase of a situation that could result in CFCs is called fibrocystic. So women get like knots and feels like fibrous cords in their breasts, and of course they become painful around ovulation, and then they go down. Right, has to do with estrogen. So estrogen and iodine. And one of the ways to eliminate the fibrocystic problem is with iodine. And for some reason, they found out in the 30s, I don't know how they figured it out, but by painting the inside of the vaginal wall closest to the cervix with the Lugols daily, it would get rid of the breast, fibrocystic breast 100% of the time. But you don't have to do it vaginally. You can do it orally. You can put on your breasts. There's other ways of getting it, but it's just that was. But it only worked in women who still had their ovaries. If they had surgery and lost their ovaries, then that wouldn't work. The vaginal painting. All right. Okay, so now, so like if someone has inflammatory breast CFCs, which is kind of a real nasty one, you use even higher doses, and you can give it IV. So it's not you don't go give Lugols. It's got to be prepared specially by compounding pharmacists, and you got to have a doctor who actually knows what they're doing, and then you can get IV. So would not worry about you taking too much, okay? And I want you to remember something. You have to understand that the inadequate amount of not getting enough iodine causes cells to shift, because what iodine does, the molecular iodine, one of the things it does many. I mean, it helps estrogen metabolism for the estrogens to be metabolized into healthy metabolites. But it also is it induces apoptosis, which is programmed cellular. Oh, I can't get on social media. I can't say the word. Okay, programmed cellular expiration. Programmed cellular not alive anymore. Yeah, I don't know how to say it. I gotta always be kind to the social media, because they really care about our ears and our hearts, and they want to make sure that that we don't harm each other with our words, even though they're going to use words like COVID and pandemic and but let's not. We got to be careful. They don't. Okay, they don't have to be careful. Oh, sorry. The question was, Phoebe. Yeah, what's he talking about? This guy. I'm talking about iodine, because she thought she was taking too much, and I'm just here to say you're not taking too much. Don't worry about it. And I want you to remember that the average Japanese, from the time they're 3 years old, who's eating a pretty traditional Japanese diet, is getting 13.8 milligrams a day. Right now, I want you to understand something too, which is very, very amazing. And that is where is it? I found it. I couldn't believe it. Where was it? Okay, so the recommended daily allowance by the Fraud and Death Association is that we should be getting 125 micrograms a day. Now, micrograms. Okay, so that is 0 0.125 milligrams. Not even 1 milligram, not even close to 1 milligram. And yet, Japanese are taking 13.8 milligrams a day, and they are one of the healthiest populations we know of. They live 10 years longer than us. So you might want to think that maybe the guy's giving us advice, man, because they told us not to eat soy, and these guys are eating it and they're living longer. They told us not to take iodine. They might be twisting the truth. That's a nice way to say it. This has been medically proven that. Okay, all right. So I just wanted to bring that up to you. So now what else? Well, while we're at it, for women, what else can cause? So iodine deficiency, yes, can contribute to the development of CFCs in the breast, in the prostate, colon, lung, stomach, pancreas. In case you're wondering. Now, another thing is that's just mammograms. Okay. So, if you get a mammogram, it increases the risk of developing CFCs. As I said, it increases from 1% to 3% per year, depending on the technique. So if you're very, very strict and you get a mammogram yearly for 10 years, you've increased the risk to 10 to 30% of getting it. So that by the age of 50, 45% of women will have CFCs in their breast from getting the mammograms. Did he say that? He said that. Ask Dr. Jen Simmons as well. Anyway, they don't tell you that. They also don't tell you that a woman who wears a bra 24 hours a day increases her risk of getting breast CFCs. And they found that women who wear them only 12 hours, but not to bed, lower their risk. So the idea there is that, why is that? Think about that. Because a bra, now bras became what they are today. Well, now there's all sorts, but the uplift bra came about from a movie directed by Howard Hughes, starring Marilyn Monroe and Jane Russell, and it was called Gentlemen Prefer Blondes. Big movie. I think it was the 50s, 40s, maybe late 40s, mid. I don't remember. I mean, I wasn't there, but I've seen it. Anyway, Jane Russell. No, Howard Hughes didn't direct it, but he invented the bra, the uplift bra. You know Howard Hughes Aircraft. He was into flights and he was into getting things up in the air. Well, he did the same thing with breasts, and he came up with a bra. So he had the bra, the uplifted bra, and yeah, we stream on everything, Dimitri. We stream on we stream on YouTube, Instagram, Rumble, LinkedIn, my website live, drlodi.com. Anyway, so we stream all over the place. We're streaming. So what happens is, in the uplift bra, you're preventing the breasts from bouncing and moving. So when a woman would walk naturally, the breasts would move. Remember, we talked about, you stop moving, you're dead. So keep moving. Anyway, you don't want to stop the breasts from moving, because the breast, remember, what I didn't mention when we were talking about the structure of a breast, you got ducts, you got little sacs, ducts, connective tissue, fat, and you've also got blood vessels and lymphatic vessels. And those lymphatic vessels cannot work. Remember, both veins and lymphatics require movement, muscle contraction, to flow. So you're decreasing the flow. You're getting stagnant breasts. All right. So if you wear a bra to work, when you get home, take it off. If you're, you know, if you're not pendulous, if you don't have extremely large breasts, and you can not wear them. And if you're worried about, your, what's the word? Modest. If you're a modest person, they have those things you can put over your nipples, right? So that you can't see the nipple. And yeah, there are ways of doing it. Or now, and now they have bras that don't lift, right? They're kind of like, I think maybe the sports bras, but those sports bras are designed to be. Anyway, you want to keep your breasts bouncing, right? Bouncing breasts. Okay. Now, the other thing that I wanted to bring up, and this is the thing I was not going to, I didn't want to talk about, but I have to talk about it because it's just true. And in fact, this addresses a question by one of our members. Had recently asked me. We've always talked about to decrease a male's risk of prostate CFCs. The male needs to ejaculate 21 times a month. This is what the studies show. Okay, I don't know why 21 times, but just to be safe, that's. So anyway, it turns out that. And there's a study, essays on sexual function as the cause of breast CFCs in women, how correlation and cultural blind spots conceal causal effects. Okay, and so it turns out that sexual frustration in a woman produces a dissonance. Cognitive dissonance is when you have two opposing ideas in your head, you can't put them together. Kind of like what they did to us in 2020. Anyway, so sexual frustration has to do, and with what they're talking about in this article was between the absence or lack of sexual reward and the unconscious motivation to obtain sexual rewards. What is meant there? What is meant is that the woman's not being satisfied sexually. But she's not supposed to, right? According to most of our cultures and religions, and you're not supposed to enjoy it. We're just having babies here. Well, hey, you know what, folks? I know having a bowel movement is just to eliminate stuff, but they're kind of enjoyable if you're full. And same with urinating, kind of enjoyable, and you finally get to urinate. So why can't this? Anyway. Well, that's okay. We don't mind that. And eating is kind of enjoyable. Well, yeah, well, that's fine, but not this. Anyway, so it turns out that prolonged sexual frustration leads into an aberration in the metabolism of sex hormones and related to development of breast. So that human female sexual behavior research links sexual frustration with the development of breast CFCs. By the way, women's sexual response is due to androgens, not estrogens, just like men. So when we talk about women, we need to make sure, if we're going to give them hormone replacement, we need to always make sure that that we pay attention to the androgens. And what they're recommending in this article was that closer examination of the unconscious female copulation strategies. I hate these words. The words copulation, vagina, penis, intercourse, they're so clinical, like they're the opposite of arousing. That's why they use these words. They're copulation strategies. What the hell is copulation? My cat, I have a cat, a male cat. And this guy's screaming on like, he's like, he wants to. And you know what? It's just part of his copulation strategies. Yeah. Yeah, cats have copulation strategies. Ridiculous. The words they use. And the other thing, postmenopausal women are vulnerable for the self-fulfilling prophecy, okay, about post-reproductive sexuality. So hormones go down, libido goes down, vaginal dryness, etc. And so you just naturally don't have sex. Is that okay? Well, nah, it's really not. It's really not. It's okay to have sex. In fact, it's healthy. It turns out it's healthy. All right, for many, many reasons. And in fact, the entire ejaculatory response of a male and of a female is really important for all kinds of things, which we can do a whole course on that. But here in Thailand, there's a Chine-san and what's the other one called? There's two interesting massages that they have here. One is called, I think, Chine-san. What's the other one called? Okay, so the one is where they massage your internal organs, and that's pretty, you're lying down. They find the way to get all your organs, right? And then it's really good to go get a colonic after that. It's really helpful. But they also do genital massage, and it's not at all sexual, at all. It's the opposite. It kind of hurts a little bit. So, and it's for females and males. I forget the name of it, because not everybody can do it. I mean, you've got to be really well trained. But do I read all the comments? Yeah, I try to read them when I'm done here. When I'm done, I get to read them. Yes. And our join the, just go to drlodi.com, and there's 3 groups: health and healing, parasites, and CFCs. And join one. Anyway, so these, it's not enjoyable. You think, well, go genital massage. We're on a happy ending. No, not a happy ending. It's kind of I'm glad it's over ending. So with the male, they actually are holding the testicle and very lightly putting pressure and moving the lymphatics, but lightly on a testicle is not fun. All right. And the females, I'm not sure how they do that, but, and usually the people that I've seen are like women that are older and, with really, like, they've been massaging all their life. They're really thick hands and all that. Anyway, no matter what anyone's sexual orientation, these women that do that would fit into no one's. There might be some freak, but usually because they're not sexualists at all. So, but it's very important, and it has to do with blood flow and because what we're. In fact, there was a place up in Dow Gardens where I opened my first clinic when I got here in Chiang Mai, and they used to have women and men who were come as a pre-honeymoon. They were going to get married and then have a honeymoon, and they did these several sessions before just to get things flowing. Okay, and why do we need to get that flowing? Because we are repressed psychologically from the time we're young. We're so don't look at it, don't touch it. Girls sit like this, all this stuff. So that's what we grow up with. So psychologically, we kind of constrict everything down there. We don't have good flow. All right, so. One other thing about iodine, you guys, let me just tell you, any skin CFC, melanoma, basal, squamous, all right, even warts, 7% Lugol's. Keep brushing it on like 10 times a day. Gone. Got to keep doing it. Okay. Now. So don't worry, Renuka, about the iodine, but you got to do your diet. You should, you eat, if you're eating raw food, at least 90%. Listen, if I had CFCs, I'd say 100%. Right now, I'm going to do 100% until they're gone. And then I'll go back to 80-20. But, it's just, I want to get there. But anyway, do the best you can, 80-20, 90. And when you do cook, make sure it's only steamed or boiled, nothing else. But get good with a dehydrator, then you'll have the same taste of cooked food, but it's not, and you'll still have all the what do you call it? Oh, you're welcome. Talking about this, yeah. You'll still have all the enzymes. Okay, a dehydrator, it's fantastic. You got Excalibur is the one I have, and it's probably the most well known. So don't worry about too much. And I just want to think about the sexual thing with women. For some reason, I don't, this, and it all comes, these religions, they, it's such a bummer. I'm so, I'm so glad I was born a man, just because women are just, they're mistreated from the beginning, and then they have to put up with men. I mean, God, on top of it all. Ugh. Anyway, I would definitely be lesbian if I were a female. No question. But anyway, but the whole thing, if you go back to Rome, you go back to Greece, all the women have always been like second class. Women, do you realize that women were given the same educational opportunities as slaves, unless they were from wealthy families? And then they couldn't learn certain things. They could only learn they couldn't learn anything that would allow them to like participate in society. And yet the entire social structure depends on the women having children. And for some reason, women are supposed to be, think of the sanctity of motherhood. I mean, it's like, Mother Mary, my mother. Don't talk about my mother. Everyone, my mother, right? It's probably the most sacred role in all societies. But guess what? Now, I want you to try to keep this. Don't let everybody know this, but you know how you get to be a mother? Oh my God, that's right. Someone's going to have an orgasm. I mean, if the woman might not, because she's not supposed to, someone had to have an orgasm. Can you imagine? Disgusting. So, the road to the sanctity and the sainthood of a mother means you had to have done something pretty nasty. Isn't that weird? Now, why would God make that? Now, if God made it that way, then how come you're saying it's bad? You realize? And then, I mean, it goes on and on and on. So, and by the way, I go into this in the book that's coming out. That's the problem. I go into this too much. It's going to be too long. Anyway, let's go. So, namaste, Renuka. And by the way, aloha to everybody. And I'm going to show, I got to talk to you. I got to tell you why aloha is such a special word. And I will do that in a video, and I'll post it. Aloha is just a very special word. Aloha. Aloha. Okay, now, Murray, prostate CFCs. My PSA has spiked from 0.6 12 months ago to 3.8. 12 months ago to 3.8 3 months ago, and it now is 4.2. The red flag is that I may have early onset of prostate CFC. I have been booked in to see a urologist at the end of May to investigate the potential problem. I am loath to go down the surgery and chemoradiation route if tests come back positive. I have been following reports that ivermectin and fenbendazole combination can help to control or eliminate prostate CFC along with lifestyle changes. Should I try ivermectin and fenbendazole for the next month prior to more PSA tests and scans to see if I can reduce the CFC, if I do have CFC? All right, Murray. We need to We need to change your vocabulary. Okay, psycholinguistics, linguistic, are the words that we use form the scaffolding of our mind and are therefore our perceptions. And perceptions are based upon, I mean, they have something to do with sensory input, but then of all these synapses and the end perception is different. But I have to tell you something too. Just like that perceptual set, what does that mean? You're set to perceive certain things. Your mind is set to perceive certain things, and you won't perceive things that don't fit. All right? I guess you could say closed-minded, rigid. But we all have a perceptual set. We've got whatever we've been through, whatever's happened to us, we have perceptual sets. All right? Now, the scaffolding is our language. We change the language and we change the perceptions, and perceptions are reality to you. Doesn't matter if they're reality. If I, an alcoholic who's going through delirium tremens, and they're seeing whatever they're seeing, it's real to them. The schizophrenic who's having an argument with someone we can't see is it's real to them. Okay, it's like that, right? The person who believed the whole great hoax story of 2020, it was real to them, and they were afraid of this invisible enemy that was going to get them, so they were willing to inject themselves with poisons to, I don't know to do what, but they told me to do it, right? What do we know about fear? Fear will. When someone's afraid, they will follow suggestions by authority figures, even if they know they're going to hurt them. I'm not. This is not. I wish it was not true, but it's true. Anyway, so we got to change your whole thing. You're looking for it. In fact, your language, you already got it. I want to help control or eliminate it. You already have it. And then at the end, you say, if I have it. But you already have it in your mind. And you're looking at PSA, and it's going up. And so you're going to go to the urologist. And they are CFC hunters. So they're going to do the PSA. They're going to, if they find anything on a digital exam, they'll do a digital exam. It's a rectal exam to feel your prostate. If they feel anything at all, they're going to go in and do a biopsy. If they do a biopsy and it is CFCs, it will just have spread it around. And so then you've already decided that the only things you can do are chemo and where was it? Yeah. All right. Okay, so you're looking at the ivermectin and the fenbendazole to get rid of this thing that's got into you, that may have gotten into you. So you're looking for weapons to fight this thing. This is your mindset, and you're not at fault. I mean, Murray, you grew up in America or Western world somewhere, and that's the whole story. The story is they're gonna get us. They're out there. There's diseases all over the place, and there's that big one. It's CFC, and that one that gets into you. Oh my God, you got to throw bombs at it. Yeah. Oh yeah, that whole thing is just wrong. It's just wrong. If you're developing CFCs, and if the PSA happens to be an indication, it's not always, okay? You can have a high PSA for other reasons. You can have just an enlarged prostate. And especially if you don't ejaculate 21 times a month, You're going to have an enlarged prostate. You're going to have a prostatic congestion. You're going to have a problem. And that's just one of the things. So you can't just look at that. So yes, ivermectin, and you want one other one, niclosamide, and you also probably want nitazoxanide. That would be a great thing as long as your liver's okay and all that, and you do it for an extended period of time in cycles. Now, yeah, they're fantastic for CFCs. And parasites, of course. But that's not all. You've got to stop making it if you are producing it. Because it's just not something that got into you. It's something. It's your body the cells are adapting to situations that are not in their favor, and they're becoming they're fermenting. So you want to stop that process, because if you don't stop that process and you keep using tools or weapons to get rid of it, it's going to be a never-ending battle until you're dead. And usually, if you go down the route of the conventional warlocks and witches, you're going to wish you were dead. You get to the point where I don't want it. And it's not because of the CFCs, it's because of what they're doing. All right. So, and by the way, surgery doesn't help. You said you're loath to do surgery and chemoradiation. Well, that's good, because they don't even help. They don't help. I'm sorry, that's not true. It's not that they don't help. They make it worse. Yeah. They make it worse. So that would never be an option. It would only be an option if you were assisted suicide, I guess we can call it. But anyway, it's not an option. So what the option is to get healthy, restore the balance in your body. Okay. Keep your prostate empty. Stop eating animals. Animals and prostate CFCs just really go together. I mean, it goes with all of them, but particularly this one. Stop eating animals and anything that came out of an animal, right? Don't eat animal, secretions, like, I don't know. What are the things that come out of animals? I mean, besides urine and feces? Sweat. Yeah, sweat, and what else? Half of the animals produce milk. Yeah. Anyway, you just don't take anything. Eggs come out of animals. Anyway, so just leave the whole animal. Let them be. Love them. Don't eat them. Yeah. Take care of them, or at least don't hurt them. If you don't like them, okay, great. I don't happen to like certain people. I'm not going to kill them and eat them. Anyway. Change your diet, go to sleep early, start moving around, all things, do a cleanse, check out your teeth, go to a biological dentist, do all that, and cancel your appointment with the guy. He's going to find a problem. I promise he's going to find a problem. And you don't need to have a diagnosis. Diagnosis is a spell. It's a hex. You don't want to be diagnosed. You want to just say, right now, you know what? I feel like I need to clean myself. I need to rebalance my life. That's all. And don't think about you're checking your PSA. You better check your CEA, and you better check your CA 19-9, and you better check your alpha fetoprotein. You better check all the. No. Live healthy. The best insurance is to live healthy. Clean out. Keep things flowing. You don't have CFCs, and if you do, they're going to go away because you're not going to let them continue. Okay, it's very simple. Now, okay, Murray, change your mind. Don't use these words. Don't use that word. It's an astrological sign. Stop using it. So, in order to to ejaculate 21 times a month, you're going to have some testosterone. So you're going to have someone, a intelligent physician. Yeah, I did say that, right? Yeah. So, I mean, there's some out there, I think, and you got to get them to help balance your hormones. Oh no, we can't give him. You can't give him testosterone. Why? Oh, well, risk. Wait a minute, the guy that's in Gold's Gym who's got bulging and an erection all day, he's got a lot of testosterone. He doesn't have it. So what are you talking about, doctor? Listen, they make no sense. Don't eat soy, don't eat iodine, and no testosterone replacement. And no HRT either. Okay. Now this is Terry. Terry says, I would like to get the parasite cleanser, have dogs and cats. Oh, for your dogs and cats. Well, that's easy. You just go to a veterinarian and they have both ivermectin and fenbendazole for dogs and cats. You know, there's a certain dosage per kilogram of body weight. But that should be easy. And in fact, I think you can even get fenbendazole for dogs online. You know, that shouldn't be hard at all, Terry. Brianna. Okay, so Brianna, here's a draft letter. Dear Dr. Thomas Lloyd. Thomas Lloyd. Are you talking to me? I hope this letter finds you well. I'm reaching out to seek your expertise in helping my daughter undergo a natural detoxification process and remove parasites and heavy metals from my 2-year-old daughter body. Whoa. Could you please advise on the best course of action, including 1, natural cleaning methods and protocols, 2, parasite removal strategies, 3, heavy metal detoxification plans, preparation steps for my daughter before starting the detox process? Whoa. Okay. Well, listen, Brianna, 2-year-old daughter, you think she's got heavy metals and parasites already? I mean, it's possible. I mean, she does to some degree, of course. But is there something that's making you you're very specific with parasites and heavy metals? So I don't know. So your daughter's 2 years old. First of all, being that young, her body's eliminating things very well if she's fed properly, if you feed her human food. And human food is, sorry, I'm so sorry. Sorry for those who don't want to hear it. Well, close your ears. Uncooked plant food, which includes nuts, seeds, fruit, and plants. Stems, roots, leaves. What else? Roots, stems, leaves, trunk. Yeah. Flowers, fruit. Yeah. That's our food. So I know if you're feeding her that, she'll be, and she's 2, so you can blend it up, put it in the blender, blend it up, make her soups and stuff like that. Avocado, spinach soup, delicious. A lot of raw almond butter, a few tablespoons, blend it up, a little some water and broccoli, really good. Well, you can make a lot of good soups for her. That would clean, and so you don't have to give a 2-year-old enemas or colonics, because if you just feed them right, they're going to be moving nicely. Make sure she's running around all the time. Put her to bed. She goes to bed, period. The time is an hour after sunset. Well, no, it depends on where you live. Wait, let me take that back. 8 o'clock, latest. 8 o'clock, all children go to bed. Okay? And guess what? Who goes to bed with them? Yeah, mommy and daddy. Yep. 8 o'clock. And you don't have to tell a kid to move, because that's what they're going to do all day long. They can't sit still. Kids are like they're natural. Now, regarding heavy metals, with her at her age, unless she's had some bizarre exposure, you can pretty much take care of that with some really good botanicals like chlorella, and I would get the what do you call it? What are those? Anyway, the drops, they're like nano-sized. Anyway, let me see. Let me go. Let me see if you guys are. Anybody's telling me. Is anybody? Explant. What you recommend to follow? Bed bras will now last me the rest of my life. Bed bras. No bra. Let the air be your bra. Okay, nobody knows. What's that stuff? What's that stuff? Everything. Anyway. I forget what it is. Anyway. Anyway, so there are lots of botanical ways of chelating. And remember, vitamin C is a chelator. These things. So you want to be giving her, if you're giving her a whole food, a whole plant food diet, she's going to be like crazy healthy. And you can give her, you know, you can take vitamin C in, powder like sodium ascorbate and put some in her different juices and stuff like that, just to give her some extra, because she should be eating real food, which will have what we need in it. Now, so I'm really kind of wondering what happened. So the parasites, as I said, now she can take ivermectin and fenbendazole, but it's got to be dosed appropriately. And I would have to look it up for your daughter. Let me just see if I can find it real quickly here. Okay, so because remember, ivermectin is being taken all over the world by children for river blindness and other things. (150 micrograms per kilogram of body weight. Children weighing 15 or more. Children weighing 15 kilograms or more can receive ivermectin. So onchocerciasis, which is the river blindness. Yeah, so they give it. They also give it for scabies at 200 micrograms per kilogram. So children weighing less than 15 require a dose determined by a doctor. Has safety data for this age group is limited. Determined by a doctor. Doctors don't know anything. But anyway, you really need to talk to somebody, because I don't know why you're so concerned about a 2-year-old having these specific problems. So join the groups. Get in our group, the Health and Healing group. Get in it. And I could talk to you this week. Tuesday. My Tuesday. Your Monday. Tomorrow. Okay. Now, okay, here's one. This is Liz. It's about biological hormone replacement. I decided not to take them after having breast CFCs. Does that mean that I will never heal? I will continue to come back. It will continue to come back. I'm over 60. Is it mandatory to take them to survive? I follow a strict healthy protocol Why can't that be enough? And age naturally the way God intended. Agreed, 100%. However, if we were doing what God intended, we wouldn't be reaching menopause and andropause at 60. Maybe at 90 or 110. We have an accelerated rate of menopause and andropause. And we know that because we see groups like the Hunzas, where the women delivering children at the age of 65. Men getting them pregnant at 110. We have a very accelerated program here. But understand, too, that when you go into menopause, it's not just that you stop having periods. And it's not just that you have vaginal dryness and low libido. You also have osteoporosis, cognitive decline, risk of coronary artery problems, risk of stroke. So yeah, and then you'll shrivel up. But like, according to my age, I should be shriveled up and using a walker by now, but I don't want to do that. So you don't have to. No, I'm just saying that I would. Yeah. So as you had CFCs, because if you have so that's why you didn't want to do it, because your thinking is, well, the estrogen caused it. It wasn't. It was an imbalance. You probably most likely were estrogen dominant, meaning you didn't have the proper balance. You probably didn't have enough iodine. And then I don't know about your personal life, but there's a lot of things that go into it, what you ate and all that sort of things, so it's, but it wasn't caused by a hormone, okay? An imbalance. And all you want to do now is make sure you do restore the balance, because menopause, again, is putting things out of balance. It's taking them out of healthy cycles. So, yeah. So, Luigi, I'm 90 years old and I'm planning a 15-day water fast. Do you have any book recommendations to help guide and support me during this time? Yes. The Science and Fine Art of Fasting by Herbert M. Shelton. The Science and Fine Art of Fasting by Herbert M. Shelton. And also, oh yeah, well, anyway, another one is Fasting Can Save Your Life by Herbert M. Shelton. The Miracle of Fasting by Bragg. I'm glad you asked, because that's really what you need to be doing, especially the first 4 or 5 days, so you don't think you need to eat. It's very important. Oh yeah, and for those of you, when I was saying, when I answered the question about drinking urine and stuff, I read this was probably one of the original books on it. So it's not that I'm not. I get it, but I don't get it. See the color of that book? Nah. I can't see myself drinking anything the color of that book. Anyway, yeah, those are the books. And the thing about water fasting is that the hardest part is the hardest part is to decide to do it. Second hardest is the first 3 days, and then you're fine. But you got to drink lots of water. You got to drink at least 3 liters a day. Drink 3 liters a day. A couple times a day, get some sea salt, Celtic sea salt, Himalayan. I heard the Himalayan is not really Himalayan and that the pink is not. So I don't know. I'm just trying to get some good salt. Like a half teaspoon twice a day and a little bit of water. And chug it. Make sure you're drinking a lot and peeing a lot. Read. The first 3 days, read so that you can say, yeah. Instead of, Question 2, melatonin sleep. I'm struggling to fall asleep and I want to try melatonin. Where can I find the best quality? And do you recommend taking 30 minutes or 2 to 3 hours? Okay. Yeah. The melatonin, there's so many places online and, you got to find a good, actually, if you come to our group, because the people in our group have been doing this research, we've got a list of resources of where to get like all good stuff. But the companies I like are Gero, Gaia, Now, NOW. What else? I haven't bought anything like recently. I mean, it gets sent to me, so I don't even. And you can get but yeah, start taking it. And it's not just for sleep; it's for your immune system. It's for a detoxing. It's an antioxidant. And in terms of when do you take it, if you're taking capsules, maybe you can take a few capsules. And don't worry about getting too much. Hard to get. It's impossible to get too much. Start out with low dose, maybe 3 milligrams, and then 5 and 10. You want to go up maybe to 50, 60 if you can, but it might be too much at your age. Could make you too sleepy. It's a powerful benefit to us. But I don't know. Our pineal glands have been really assaulted, so we might not have. Anyway, so you would take the pills maybe an hour before. If you're doing sublingual, you'll do that just as you go to sleep, but not 2 or 3 hours before. And then the third question was alcohol addiction for your mother. She's addicted to alcohol and you're worried about her. Is overcoming alcoholism possible? And what steps would you recommend for her and me? Okay. Well, the first step is for your mom is to realize she has a problem, and the second step is to want to not have the problem. So if she hasn't, a lot of times people are in denial. They won't acknowledge that they have it, or if they do, they say, "So what?" But if she knows she has it and she wants it, then that's the first step. Now, depending on how long she's been in it, I would recommend going to AA, Alcoholics Anonymous. They've been around for a long time. They have a great program. These are people that have been through what she's been through and worse, and they can help her. Right? There's no professional out there that knows what they're doing. None of them. You go to AA, and you can go to the Al-Anon, which is for the family. So there's groups for the family who are having to, deal with someone in their family, whether it's a spouse, a child, or a mother, or a friend. And so you guys get together and you go through and share how you can help each other. But this is where you get the information. And the same with narcotics. They have Narcotics Anonymous. They have Overeating Anonymous, Gamblers Anonymous. These things work because you're with people who've been through it. And there's a 12-step program. And these 12 steps are good for all of us. All you have to do is have that first step. I realized I was helpless. You can say that. I realized I was helpless over eating cooked food. I'm helpless. Anyway. So yeah, good. I'm glad you're doing a fast. That's fantastic at age 19. All right, you guys. We didn't get too many. Sorry, I didn't get to so many. I got to answer these questions at some point. You guys have so many questions. Anyway, shoot. So many. Okay, listen. I don't know how we're gonna do this. We gotta have this every day. If I did this every day, we could probably get some answers. Anyway, have a fantastic week. I'm sorry, RGCC, no, and then no. Waste of money. All right, Sawadee Kap, Namaste, and Aloha, everyone. See you next week. Unless you join the group, then I'll see you tonight or tomorrow. All right? Okay, Sawadee Kap.